Microplastics in our bodies. What are they doing to our health? Plastic isn't just choking our planet. It's invading our bones, brains, and blood. Scientists are racing to uncover what this invisible invasion means for our health. Here's the unsettling truth about how microplastics are reshaping our bodies and why we can't afford to ignore it. Let's rewind to 1843. Victorian innovator John Bennett Laws, a fertilizer pioneer, launched an agricultural experiment to boost wheat yields. Without computers, his team preserved their research the old-fashioned way, bottling soil, grain, and straw samples. Fast forward 182 years, and this archive at Rothamsted Research in Harpenden has become a chilling time capsule of human impact, including the dawn of the plastic age. Andy MacDonald, Rothamsted's keeper of the bottles, reveals a disturbing pattern. Post-1960 soil samples show a plastic explosion mirroring global production. Plastics entered farms through tractor tires, packaging, and even rain, he explains. But here's where it gets controversial. These preserved bottles now hold evidence of our toxic legacy, from radioactive Cold War residues to the first microplastic traces. We're now eating, drinking, and breathing plastic particles, up to 52,000 annually by some estimates. They'd infiltrated every corner of our biology: blood, breast milk, liver, kidneys, and even bone marrow. A 2024 study found global microplastic consumption skyrocketed 600% since 1990, with the US, China, and Scandinavia among hotspots. But here's the million-dollar question. What's this doing to us? In 2025, 8 volunteers chugged microplastic-laced tea and microwave meals in a London lab, the first human challenge trial for plastic toxicity. Led by Imperial College's Stephanie Wright, this Mindery Foundation-funded study tracked how plastics migrate from gut to bloodstream. Heating plastics, like your morning tea bag, releases far more particles, Wright warns. Results pending, but early data suggests smaller particles slip into blood vessels, potentially accumulating in organs. The stakes couldn't be higher. A 2024 bombshell found microplastics in 80% of carotid artery plaques, linking them to 4.5 times higher heart attack risk. Even more alarming, dementia patients had 10 times more brain plastics than healthy counterparts. Plastics hitchhike into the brain via fat molecules, explains toxicologist Matthew Camping. Once there, they may accelerate neurodegeneration. But here's the twist. Scientists refuse to call plastics the new asbestos. They're stealth attackers, says Portsmouth University's Faye Cusero. They don't kill outright, but wear down your body's defenses over decades. Think of them as inflammation boosters, aggravating everything from arthritis to asthma. The problem, plastic isn't one villain, it's thousands. Bottled water alone contains 240,000 particles per litre from 7+ plastic types. Each plastic behaves differently, stresses Vienna researcher Verena Pickfer. Some host antibiotic-resistant genes, others may promote tumours. So where do we stand? Researchers still have much to uncover about the hidden toll of microplastics on our health and environment. Microplastics and your hormones. Fertility at risk? The hidden health crisis. Silent saboteurs. How plastic particles could be undermining your hormones and fertility. Imagine a world where the very convenience we've come to rely on is quietly turning against us. A recent scientific review reveals that microplastics, those tiny particles that have infiltrated every corner of our planet, are not just an environmental issue, but a health crisis in the making. They're disrupting our hormones, damaging reproductive organs, and costing the US billions in healthcare expenses. Natasha Gilbert, reporting for US Right to Know, has shed light on this alarming issue. https://usrtk.org/healthwire/microplastics wreaking havoc on human hormones. Micro and nanoplastics release toxic chemicals that interfere with the endocrine system, targeting critical glands like the hypothalamus, pituitary, and thyroid. These particles accumulate in reproductive organs such as ovaries and testes, potentially harming fertility in both genders and increasing the risk of reproductive cancers. Current regulations are lagging behind the growing body of evidence, prompting scientists to call for a global treaty to limit plastic production. A key insight: we are already witnessing the effects of plastic pollution on our health and the health of our children. The solution lies in capping and reducing plastic production. Tracy Woodruff, Professor and Director of the Program on Reproductive Health and the Environment, University of California, San Francisco. The significance. This comprehensive scientific report exposes how micro and nanoplastics are not just littering the environment, they're infiltrating our bodies and potentially derailing the hormonal systems that govern essential functions from metabolism to fertility. While plastics have become indispensable in modern life, this research suggests we've overlooked a long-term biological impact. The cost is staggering. Billions in health expenses and a generation grappling with fertility issues and hormonal imbalances. Dive deeper. A stalled global plastic treaty jeopardizes our future fertility. https://w.ehn.org/stalled global plastic treaty. To combat chronic disease in the US, the FDA needs to tighten control over toxic chemicals in our food. https://FDA grouse loophole opinion. Plastics may disrupt the body's internal clock, increasing the risk of chronic disease, a study finds. https://America FDA grass loophole opinion. About the curators. EHN curators are curated by a company that's infiltrating our bodies, preventing chronic diseases and hormonal imbalances. But here's where it gets controversial. While the scientific community is urging for stricter regulations, the plastic industry argues that the benefits of plastics outweigh the risks, and that the focus should be on recycling and proper waste management. What's your take on this? Share your thoughts in the comments below.